back. This is going to be section 3 of the NEMT training program, or wheelchair training program, created by Medstar Ambulance. I'm Rachel Madden, the Director of Operations here, and we're going to be in the third and final portion of the training. This portion is very much one of the most important ones. Patient care is obviously the most important, but documentation could not be more important in our field, especially in the times that we're in. So we're going to talk about forms and reporting. You should have forms available to you by your company. Those are going to include accident and incident forms, forms for if you get any kind of exposure to anything, forms for just about everything you can think of, including the vehicle itself. When you're coming in for a shift in the morning, you should definitely be doing a check and filling out a form for that, whether it be digital or on paper. So overall, this is going to be a very important section, and we're going to get into a little bit of detail about that. So as we move on, we're going to say that non-compliance is going to be a very serious problem. If you have someone who comes in every single day, doesn't perform the check on their vehicle, which may include checking the oil, we can end up blowing an engine. So this becomes very important, and it could be very costly to both yourself and your company for not doing the work that's assigned to you. So this is an accident or an injury report form. When we are filling these out, we're going to be talking about specifically what happened, but not what we think happened. An example of this would be saying something like, Mrs. Jones slid out of her wheelchair onto the floor. This was observed right away. Vehicle was stopped safely. Mrs. Jones was assisted to sit back in the vehicle. Safety belt had become unattached. Reason that it became unattached, unknown. That would be how that would be written. How it would not be written is, Mrs. Jones slid out of her wheelchair. She probably unbuckled it. I'm not sure what she was thinking. I went and helped her get up, and I think she'll probably unbuckle it again. We're not going to say things that are assumptions or things that we didn't see in these reports. And they become really important later on, because maybe Mrs. Jones comes and she says, this wheelchair driver didn't buckle me in, and that's how I fell. Alrighty. So we're looking at bodily fluid cleanup. We do have an entire bloodborne pathogens course that we do offer. It is not required for the position that you're currently in, but we're definitely going to cover that information now. Unfortunately, people get car sick, they develop illnesses. Some people just have conditions in which they occasionally vomit, or their skin is thin and they may tear it by accident. So this is how we're going to handle that. First of all, there is such a thing as BSI. It's scene safety, but it's also universal precautions. Treating every blood and bodily fluid as though they're potentially infectious. So that starts with putting on gloves, and in some instances maybe putting on a mask as well. If you have a patient who's vomited, there's a chance they could have the flu. So put on a mask right away and protect yourself from maybe some of those airbound particles that could make you ill. So immediately we should try and get the passenger away from the contaminated area and get our gloves on. There is absorbent material located in your vehicle. That's part of your truck check. You should make sure that's not expired. And that's going to congeal to liquids to allow you to sweep them up. After it's gotten itself to a more solid state, there is a broom and dustpan along with some other materials inside of your vehicle to help you get that into a biohazard bag. And then we're going to want to spray the area with something that kills germs, dirt, bacteria, and viruses, usually bleach bound. This cleaner is located in your vehicle as well, and there are directions on the back of that as to how long that needs to sit in order to be effective. In most cases, it's somewhere around 4 minutes. And then there are paper towels and other disinfecting type materials in your vehicle as well. That's all going to get sealed into a biohazard bag. And then you're going to want to put your gloves in the biohazard bag as well, tie everything up, and then use antimicrobial hand wipes or hand sanitizer, and then wash your hands with hot water and soap as soon as possible for about 26 seconds. If possible, you can give this bag to the nursing home or facility in which you took the patient from. If that's not available, then we have biohazard at the hospital, or there is a biohazard container located inside of our garage. Again, if this does happen, if you have a patient who vomits, bleeds, or anything else, that is going to need to be documented as an exposure and an accident incident. So we need to talk a little bit about abuse prevention. This is a very sensitive topic because it's unknown by a lot of people that certain things can in fact be abuse. So we're going to look at exactly what the effect of this abuse is and how important it is that we are talking about that and we are translating that to people who need to know. It's important that we remain professional, helpful, and serve as a lifeline for our patients that may be going through abuse, because like I've stated previously before, we pick up a patient from a facility or a residence, and sometimes we're one of the only outside people that patient sees, and we have a first-hand view of where the patient is coming from, which is very unique because all other providers that we take that patient to just don't have that opportunity. So what is abuse? Disability-related abuse is any behavior that is harmful, inappropriate, unwanted, frightening, insulting, oppressive, demeaning, or directed to a person with disabilities. So this can be things such as physical violence, rough handling, pushing, hitting, slapping, doing anything that causes bodily harm. It can be degrading the individual by leaving them in a soiled diaper and making fun of them, talking about the patient while they're in the room in an inappropriate or rude way. All of these things are considered abuse. Anything that would be considered treating someone as though they are less than human or, not respecting their human rights is considered abuse. There's also physical neglect. Physical neglect is putting a person at undue risk through unsafe environments, such as putting a tray in front of an Alzheimer's patient and them not remembering to eat and then just taking the tray away and them not eating for days. This is neglect. These are things that happen in our facilities that you need to be aware of because you are what is called a mandated reporter, and we're going to talk about that very briefly in a few moments. So neglect includes verbal or emotional mistreatment, ignoring call lights for hours and hours, treating a patient in an inappropriate, angry, mean way, threatening a patient, threatening to hit them or hurt them, or threatening to tell their family things that are untrue, putting someone down or calling them names, and some forms of abuse may occur as forced or pressured. It may involve violations of privacy or autonomy, like leaving a patient naked in the hallway while you're preparing to bathe them. And these things do happen. So when you see abuse, there is an abuse reporting form. It will be given to you along with everything else in this course. And you're going to need to document that in writing, what you saw, and also bring it to the attention of your supervisor. If you want to escalate it yourself, there is an Ohio Board on Aging you can always file a complaint with. You are required when on duty to report these things when seen. When you are off duty, not clocked in, it's entirely up to you. But when you are working, you are required to report this. And your reporting this may save someone's life or greatly change the situation that they're in and allow the end of their life to be much more pleasant. So there are some sensitivity factors that are involved with treating our patients. it's important that we identify ourselves and others who may be present when meeting someone, especially with a vision disability, but in general, we need to be introducing ourselves face to face with our patients. Hello, my name is Rachel. I'm here to transport you, making good eye contact, making sure they understand us. We need to make sure that they accept our assistance before we're providing them with any kind of care. When you touch a patient without their consent, you are considered to be assaulting them. So it's important that they allow us to treat them prior to us moving them. We treat adults like adults. We don't talk to people with baby speak and things like that. An elderly adult who may have become a little bit more simple-minded is still an adult. We do not lean against or hang on someone's wheelchair or grab their mobility device without permission. You just have to think about where you're sitting right now. If I was to just lay my arms on the back of your chair and kind of lean my head over, the wheelchair or device is an extension of that person. It is part of what their body is using to mobilize. So it's important that we are respectfully treating them and making sure that we have permission to do that. You need to listen attentively when talking to people who have difficulty speaking and wait for them to finish their statements. It's important that you restate to them what you heard so that they can maybe repronounce or change some of the words that maybe didn't come out correctly. And it's important that we're patient and we're not rushing patients who have a difficulty speaking. Do not try to stroke, caress, pet, feed, or do anything otherwise that may distract a service animal. You are permitted to transport service animals with your wheelchair individuals. Some do have restraint methods. It is important that we use those if possible, but not required by the state of Ohio. So service dogs or service animals are permitted in the vehicle unsecured. We would prefer to secure them. You do not have the right to tell someone that they cannot take their service animal. You're welcome to ask non-formally what the service animal does, but they do not have to tell you that information. And we want to tap someone who has a hearing disability on the shoulder or wave a hand to them to attract their attention. We want to do this in a non-scary way and make sure that they have our face in their peripheral vision so that they understand what we're trying to communicate to them. And this is going to be the end of the training. Remember that we always want to come home the same way we left in the morning. It's a mindset that keeps us on the edge of where we want to be when we work and potentially hazardous information. Never lose sight of what the most important thing. Your safety as well as the safety of those placed in your care. By practicing your training, you become more alert to possible dangers, and therefore to obtain success, you must practice success. It's basically the golden rule. We want to treat others as though they treat us. We want to show respect to those that we are caring for, and you are the front line of your company. You're generally where a patient starts, especially coming out of a facility. I just want to remind you of the requirements in order for this job. You need to pass an annual physical, which needs to be on file. You need to have an active CPR card. You need to understand that it is not your job to manage oxygen, so you do not have an oxygen administration certification. And you need to have a valid driver's license and pass a drug test and background check. So if for any reason your company hasn't adhered to any of these standards, they need to do this along with a certification within your file that you finished this program. And that is going to end us out. I wish you all the best of luck in your driving. And the update for this program, including the COVID unit, will be available within the next 2 weeks. Thank you all. Bye-bye.